She's a good girl.
Alright, for a chest x-ray you do two positions, the PA and lateral. For the PA technique I would set it at about 110 at 3.2 depending on the size of the patient. For the lateral I will do the same KV, changing the mass to roughly an 8 depending on patient size. Then I would go into the room, set up the room for the PA, adjusting the tube, the approximate height for the patient, make sure the crosshairs are lined up in the center. Setting it at 72 inches and making sure it's open to the 14 by 17 landscape. For the lateral, I've removed the cassette that was in the landscape. Place it with the new cassette portrait. Again, replace my marker. I'm over to adjust the light collimation. For the portrait aspect. And then shoot the lateral. Now for the knee, we change to tabletop. Be tinting it to center of the butt knee. Okay, and adjusting the height to 40 to 48 inches. And for that patient, for the knee AP portrait, with a technique of 65 at 5 to 6 depending. So Jordan, what's your last name?
My last name is Hockey.
And your date of birth?
It's 12/27/1912.
Okay. Do you have any necklaces or anything on under your t-shirt there?
I do not.
If he was in a button-up shirt, I would have him put on a gown. And what brings you in today?
I've had a nasty chest cough.
Okay, and that knee been giving you problems?
Oh, that knee is just killing me ever since I had that surgery here 1 year ago.
And it is the left knee, correct?
Correct.
Okay. So for the chest x-ray, have you step up to the buggy here, go ahead and face it. Put your hand behind your hip, just like that. Roll your shoulders forward. Jordan, take a small step to your right. Not good right there. Center ray, enter at T7, base of the scapula. Okay. And then shield him. Making sure if it was a female that they were pregnant. And then go back to the control room and shoot the image. Having him taking a deep breath and holding it for the image. You can breathe and relax. The lateral again, change out the cassette. Putting this one portrait as opposed to landscape. Okay, Jordan, if I can have you turn, put your left shoulder against the bucky facing that opposite wall. And are you able to lift your hands above your head?
Absolutely.
Go ahead and do that for me. Thank you. Change the collimation to portrait. Centering mid-coronally. Then, keeping it at 72, changing technique to 110 at about 8. Having him take in a deep breath, go back to the control panel and shoot the image. Okay, now we're going to x-ray your knee. So I can have you step over to the table. Go ahead and lie down. Your head toward the pillow, watch your head on the tube. And is that left knee correct?
Yes.
No. And shield the patient, being at the knee, you can either pull that apron.
Love the color.
Centering at the base, a half minute distal to the apex of the patella, collimating to the joint, depending on patient size, adjusting a tube angle if necessary, placing my marker. If I can get you to rotate your left foot in just slightly to get your toes straight up, perfect. And I would shoot the x-ray for the AP. The change for the oblique medial rotation, change cassettes. Again, depending on patient size, whether you could keep the tube angle on it or have none. If I can get you to rotate your knee internally about 45 degrees, keep going. Right about there. Again, recentering. Marker is in place. Now shoot that image. For the lateral aspect, Jordan, if I can get you to roll onto your left hip. And your right, there you go. Roll back just a hair, you look perfect. And centering. Collimating to the appropriate size. Placing my marker. And changing the cassette. It's not double closed. And shoot the lateral image. Again, techniques for the knees are roughly the same. That's 65 at 5. After shooting the lateral, Jordan, if I can get you to roll back onto your back for me. And if I can get you to bend your knee slightly. There you go. Little left angle. There we go. Let's see. You can do this again, Bucky. For the clear method, you get the tunnel view. You set the tube to where it's parallel with the angle of his tibula and fibula. Proper centering point. Gets the indoor condylar fossa open, collimating appropriately, keeping the shielding. And realigning the bucky with the angle of the tube. And marker in place. We shoot that image with the tunnel view. And for the last one, Jordan, what I would like to do is bend your knee up a little more. There you go. And if I get you to hold that with your hands on the back, right about there. Perfect. Lining it up. That centering point. Collimating. Put your crosshairs right where it should be. Marker. In place. We'll then shoot that one to put the patella into profile. Thank you. To scan a proper x-ray, select the correct patient. Select the test you want to do. Scan your image plate by the barcode. Slide it into the reader, and the image should appear. That's how the reader reads it.
How long will I slide or separate my side? I don't believe it's been slitting my throat so